Without further ado, I would like to invite Mr. Ivan Mwari from MasterCard Foundation. Welcome, Mr. Ivan.
It is an honor and privilege to welcome you to the Africa Health Tech Summit 2025. We know that with the right policies, partnerships, and investments, digital health innovation can become the foundation for achieving universal health coverage. Our role as leaders, partners, mentors is to ensure that these change makers have the tools and the opportunities they need to thrive. Because when we strengthen our youth, we strengthen our continent. Thank you.
And without further ado, I would like to invite Dr. Ozonia.
Our support focuses on refining and enhancing telemedicine applications, integrating them into national platforms like EMR and e-Ubuzima, and developing digital solutions for real-time monitoring and surveillance of health emergencies. Dear friends, excellencies, these are not isolated projects. They represent a new ecosystem of health technology and innovation that Rwanda is pioneering in collaboration and partnership with the United Nations system as well as multiple other partners. On our part, this work builds the foundation for a more ambitious chapter. At the beginning of this year, the government of Rwanda and the United Nations in Rwanda signed our United Nations Sustainable Development Cooperation Framework from 2025 to 2029. In conclusion, I want to remind all of us, whether you are visiting Rwanda for the first time or this is a repeat visit, this summit is a workshop. Every workshop has two parts, the work and the shop. Make sure you don't leave Rwanda with something that reminds you of this beautiful country. Murakoze cyane.
We are now going to hear from the host country itself, our guest of honor, Honorable Minister Dr. Sabin Sanzimana.
So welcome to Rwanda, Honorable Ministers, colleagues, friends, scientists, researchers, young people in the room. It's a pleasure to join you today. I want to start by saying I agree 100% with the previous speakers, because everything I had planned to say has been well covered by them, and I'll be just reflecting on a few things. I was doing some review on the past historical moments in the medicine, in humanity, what has really changed the world as humans, the way we live. And there's a long list of things, but I came up with two events in the history of medicine that have shaped the way we live today. And one, the discovery of medicine in 1796. The second one was discovery of antibiotics in 1928. And the third, I believe, today is artificial intelligence applied in medicine. As far as access to latest medical technology is concerned, is getting better and better because of technology. And when you apply to this continent, Africa, it means a lot. It means that we're going to catch up quickly. We're going to do better, more efficient, more precise, but only if we embrace technology quickly. Because it's here, it's in our hands, it's in our watches, wearables, devices, and algorithms that our young people are developing in Kigali, in Huye, in Lagos, in Addis. There's no limit. As far as you have computer, internet, your smartphone, you can do things that will change the way we live as human beings. Today, the same way in 1928 Alexander Fleming did for discovery of antibiotics, which is saving lives today. So I have probably 4 points, maybe 5, to summarize the way I see health tech for Africa and how it's going to change the way we live as people, regardless of those who have bigger economy or those who live in rural or not. I think number one is how we detect diseases before people go to hospitals. Technology, particularly artificial intelligence, is doing it already. We can detect heart attack before it happens. We can detect cancer before it even develops first stage. We can predict the clinical decision at our hospitals better than many specialists combined, but technology alone cannot do it. It must be human being, people who are trained behind. But people well trained without technology are going to have difficult times to run in this space. I think technology is moving much faster than regulations, than policies, than even our own conviction. I think we have two choices: slowing down the speed of technology, or run fast and catch up, so we run together. I think the second one makes sense. I'm now talking to my fellow doctors in clinics, in hospitals, who are still prescribing with things that patients are not going to be able to read. That is over. That belongs to the past. We are moving into e-prescription, in e-delivery of medicine, remote delivery, like blood delivery at hospitals with Zipline, our partner. That we've done this in the last 10 years. I remember the beginning wasn't easy because no one believed this is going to happen. How can blood fall from the sky into a hospital in rural Rwanda? It was impossible to understand, but today is becoming a standard. Different countries, that you can get blood at the farthest hospitals of Rwanda and save a life that is depending on a matter of minutes. Imagine if we apply this to all we do, because in medicine and health, time matters. My colleagues, Dr. Tej mentioned the outbreaks detection and response. We have now tools, all the tools that will help us to detect an outbreak before it happens. Because you can have data and numbers and have a threshold. When you get closer, you detect a response system. You collect data, you bring in your SIS real time, like our National Intelligence Center we launched this year. Most of you are probably going to visit. I recommend to visit. It's still work in progress. But when we started to think about this, and I thank our partners who helped to make this happen, was as a minister, or as a policymaker, how do you sit in a room and see the whole system without visiting every facility? How do you see a mother bleeding in a hospital for PPH that you can detect and call for help quickly, order blood, the same maternity, and save that life before you wait for another maternal death audit that the report is coming to the ministry a month after? That's what health tech should do to us. Detect quickly, prevent before catastrophic situations happens. And we can do it, we can do more, because we have talents. We have the youngest generation on this continent. More than 70% of Africans are 30 years or younger. These are the people driving these discoveries, the technology. They're building systems that are going to save us for the future, maybe discover the next vaccine, the next drug, or something that is going to help us live longer, but healthier. That is very important. However, we have a challenge to deal with. Technology alone, without humanity, without equity, without values, not going to help us. Actually may bring the opposite results that we don't want to have. That's why, as policymakers, as leaders, we must work hard to make sure policies are in place quickly in a way of helping system to happen, not blocking or confusing our young innovators. I think we need to work more collaboratively. We need to integrate systems. They talk to each other. I think this summit should make sure we all talk to each other. This is the first word I learned from our colleagues working in IT and digital. The systems talk to each other, or not talking to each other. Interoperability. So I think systems may talk to each other, but first people must talk to each other, especially politicians. Then we find ways to make sure digital era that is changing our lives, it's going to be facilitated, not to pull back. So I look forward to this summit, and I once again welcome our visitors, those who came to Rwanda first time. Enjoy your stay. Please work and shop, but also make sure you take care of yourselves. Go outside Kigali, see the beauty of the country. When you go back home, please have this in your hearts that no one visited Rwanda once. Always come back. And you come back, make it your home. So I want to conclude by saying technology is here. Health is important. As I say, you have many problems. Until you have a health problem, then you have only one problem. But with technology, we can make our health better. Let's do it from speeches and commitments. Let's go into actions, bring solutions, so that tomorrow is better and we can leave our children in a better lives and continent without gaps of our past, a continent of diseases, of wars, of, those should belong to the past because we can use the opportunity of technology to make this happen. So for young people, we are committed. You have our support. And to our innovators, partners, thank you so much for what you do. Murakoze, thank you. Have a good day.